G'day, everybody. How you all doing? Hope everybody's up early, bright sunny morning today. Where you are, we are actually evening here, nighttime in New Jersey. I want to welcome all of you guys to this long-awaited presentation. Today we're going to be talking. We talked a little bit about treating eyes last time, and there's been a lot of interest in the Micro Acupuncture 48 system that we use, that is currently the gold standard in Chinese medical ophthalmology. So I want to give you guys a little bit of a history first around the system and how it's used, like how it was developed and stuff like that. And then we will go through some of the nuances of how it works and why it works. And I'm actually going to show you guys a little bit how you can just take the system and actually start playing with it in clinic a little bit, specifically with some of your pain patients, because a lot of you guys probably are aware that Micro Acupuncture 48 is a really good system for treating eye conditions, but it's also very, very good for some other conditions, specifically pain. So we get really, really good results with pain, with neurological conditions, and with obviously eye conditions as well. So let's go to our next slide. So some of you guys, I know some of you guys had this, our Black Book of Micro Acupuncture 48. And this is, I originally created this as our clinical manual, our clinical text. And we had so many people asking for it, so we decided that we're just going to make it available to everybody. And I know, Scott, I think you still have some copies, or maybe you're all out of them. But,
yes, almost out of them. So yeah, I think it's very, very popular. So I think that definitely is a lot of interest, and we still have, I think, 3 or 4 copies left.
Okay. All right.
Yeah,
You let me know. You can get them through us, but if you guys are, on that side of the world, Scott's kind of helping me get them to you, so you guys don't have to deal with the crazy shipping and, custom stuff like that. So if you have any questions about that, I'll let you guys know. But this basically, it doesn't have the protocols in it, but it basically explains the system. It shows you the map of the points, pretty much how to use them for pain. It gives the basic history and all the points and what they're used for and stuff like that. So it's really a foundational book to really understand. If you're interested in learning more, this is without question, the clinical manual that you want to have. Whether you're just going to do courses like this, you're going to, take any of our online courses and or eventually do any of our live trainings. This is the Bible when it comes to Micro Acupuncture 48 system. So let's get into the history. So where did this whole thing come from? Where did the whole Micro Acupuncture 48 system come from? It wasn't, unfortunately, it didn't fall from the sky. It wasn't this system that I just created and invented out of nowhere. There is actually a lineage to how this was created. It is inside the book, I talk about Micro Acupuncture 48 as being a modern hybrid system. Hybrid meaning that it takes a lot of different systems, acupuncture system, and that's how it was developed. So it's really like a new evolutionary system, modern acupuncture system that, as we know, we talked about, has specific benefits for neurological issues, eye issues, and pain. There's also gynecological implications, ADHD. We treat a lot of kids with that. So let's talk a little bit now about the history and how the system came out. So Professor Zhang, some of you guys may or may not be aware of, he created a system called EQUO, all right? Embryo contained in the whole organism. That's what EQUO stands for. So Professor Zhang was kind of he was an endocrinologist, I believe. I believe he was an endocrinologist. Don't quote me on that. But I believe he was an endocrinologist. And he, obviously medical doctor who also did acupuncture. And he was pretty disenchanted with the whole meridian system. He thought it was cool, and he thought there was value to that. But he wanted to take it one step further and really understand the mechanisms of acupuncture from a neurological base, from a functional base. He wanted to understand the chemistry. He wanted to understand the chi, blood, and fluids. He wanted to understand the hormones. He wanted to understand the body chemistry and what happened. So he set up a lot of these very elaborate studies, and you guys could go online and Google Dr. Zhang, and you could find out about his research. A lot of work he did was with rabbits. He did a lot of interesting work with rabbits. And I mean, again, if you're kind of like, an animals rights activist and you don't really like, animal research, maybe you don't want to read it too much. They weren't killing animals, but one of the things he did is he hooked up the hepatic portal vein from the two rabbits, and he gave one rabbit acupuncture, and they saw that there were changes. There were biochemical changes in the hormones, in the blood chemistry on the rabbit that they did acupuncture on. So what they wanted to do is they connected these two rabbits together, and they drew blood from the other rabbit, and they found that by doing acupuncture on one rabbit, it would actually have beneficial effects for the other rabbit because they were kind of connected and the chemistry was being transported. So again, you guys can do research. I don't want to spend too much time on that, but just understand that it's Dr. Zhang's Equo system, the embryo contained in the whole organism, his mapping system. And when we do our Microacupuncture 48 training, we go into a deep dive of understanding how this system came about, and we'll show you exactly how to connect the dots and how these systems kind of overlap, okay? So he created that system. It's and you guys, if you know that system, you'll absolutely start to see some of the overlap in some of the points and stuff like that. So then you have Dr. Freddie Dahlgren, who is an acupuncturist in Denmark, okay, in the 80s. So Freddie Dahlgren, he now lives in Spain. Maybe he moved back to Denmark, but I think he lives in Spain now. Last I was in touch with him. So Freddie created, he created this hybrid system by looking at the Equo system from Dr. Zhang and then looking at the meridian system, traditional acupuncture system. So he created a hybrid system that he was very into reflexology too. So he looked at the Korean hand-feet systems, the traditional Chinese meridian system, or traditional Japanese medicine, whatever you guys want to call that. So the meridian system that we know in TGM and TCM, and so in the Equo. So we took all three of those systems and kind of molded over, and he gave birth to this new microacupuncture system, which at the time he called Oriental Zone Therapy. That was the title that he gave his system. And he I don't think he wrote a book, but I know he wrote some articles on it that I had seen a couple years ago, and I had them translated for a friend of mine. They were written in German, I believe, or Dutch. He's German Dutch. Anyway, you might be able to find those as well. So as you guys may have heard on our last talk, we talked about how Freddie got so busy. He had this big, so the story goes from Per, he had this huge barn that he treated patients out of in Denmark. And once he created this system, and the Oriental Zone Therapy, they designed it to help patients with arthritis. He had a lot of patients with a lot of farmers. They were treating a lot of farmers. That part of Denmark is very rural, and there's a lot of farmers, and that was a lot of his patients. So because of their trait, they had a lot of problems, mostly with their hands. So they couldn't do their work. They were having trouble with plowing and shoveling and doing whatever, cows and all the barnyard work that I am not familiar with. But anyway, so he wanted to help them with the inflammation, with the mobility, and all the stuff that we know that goes along with arthritis. So Freddie found that he was treating his patients and getting good results with arthritis, but his patients were saying that they saw improvement with their vision. So he was like, oh, okay. Let's kind of test that. So the vision started to improve, and they got some eye charts, and lo and behold, they were, oh my God, people's vision are improving. Awesome. So it was kind of like an accident that they were trying to treat arthritis, and they found that they were getting benefits with these eye conditions. So word got out that Freddie's treatment was really good for Oriental Zone Therapy at the time, was really good for these eye conditions, not only pain, but also these eye conditions. So Perot was a friend of his, was a peat moss farmer in Denmark, according to Per, and Freddie just needed another set of hands. There wasn't really a lot of people who were doing acupuncture at the time. So I guess it was kind of similar to what you guys might know as the NADA protocol. So instead of the ear, he just showed him a one-size-fits-all protocol with the hands, points in the hands, points in the feet, and said, all right, guys, have at it. This is what we're going to do for everybody, and we're just going to put these needles in every patient. We're going to treat them, you know, every day, and we're going to do vision testing before and vision testing after, and we're going to show improvement. So again, Freddie couldn't keep up with it, so he brought Per on to, you know, do the treatments with him. And Per decided that he wanted to take the treatments to the States, to America. So he moved from Denmark to Texas and started treating patients in Texas with eye diseases. And the newspapers started to pick him up. This is before, you know, Google and Facebook and, you know, kind of started to get popular in the 90s. I would say probably the late 90s. Freddie had started doing this in the 80s. And when I first heard about Per was in 1997, 98, something like that, probably closer to 1998. And I reached out to him because I had a couple of patients with eye diseases. He was super busy. He had moved to Arkansas and like created this huge clinic, and he was seeing, you know, I don't know, like 100 or 200 patients a day. He was packed. So I went out and trained with him, and it was actually not that easy. I actually reached out to Per. He made me wait about a year to go train with him, and then we were set to go train, and he had a little, he had a heart thing at the time, so we had to push that for about a year and a half before I actually got to go out to train with him. So it was around 99 where I finally went out and did my training with him. So what I learned was like this one-size-fits-all protocol. That's kind of what they were all using at the time. It was this main micro acupuncture protocol that those of you guys know who've taken any of my classes before. That's the protocol that we used, and it was good. Like, we were getting really good results with it. But it was primary, let me back up for a minute. So the primary cases that they were using that protocol to treat was mostly cases of age-related macular degeneration. Most of the patients at the time were dealing some glaucoma, but Per told me it was mostly macular degeneration. So early to mid-stage, not a lot of severe cases, most of them are early mid-stage. So Per started treating patients, was getting really good results, showed me the protocol, and I was getting good results, but when I started seeing more difficult patients with eye stroke, retinitis pigmentosa, you know, some really debilitated late-stage glaucoma, the results were okay, but I wanted to kind of start playing with other systems. And those of you guys who work with me know that I'm big into stacking systems. Micro Acupuncture 48 is a great system, but it is not, it's a great standalone system, but when you start to stack other systems like scalp or auricular or electroacupuncture, in my experience, we get really, really good results. So so that drove me to start to really explore the MA48 system and look at it and start to break it down and decompose it as a system, not just a protocol. Okay, so that's where I stepped in. I took the system where we were going to map the points. I'm going to show you guys in a minute. And what do these points do? How do they function? What other eye conditions can they be used for? And can we create new protocols that are going to be just as useful or more useful for specific eye conditions? So some of the systems that I just wanted to mention that are rooted in Professor Zhang's work that you may or may not be aware of is because it's a microsystem, holographic. He was one of the first guys to really, you know, bring to the public awareness the holographic acupuncture system. So for sure, Master Deng's point, scalp acupuncture, the Jiao, Ju, and Yamamoto system, Master Tan method, which a lot of you guys know is crossover some points of Master Tong points. Acupuncture 2000 Acunova, which is kind of an offshoot of Micro Acupuncture 48. Some of you guys may have studied with John Bowl. He created an offshoot of the Micro Acupuncture 40 system that was Acunova, more recently called, it was Acupuncture 2000 originally, and then in around, I think 2002, 2003, 2004, somewhere around that, they switched and changed the name to Acunova, which is very similar protocols to Micro Acupuncture 48. And other distal acupuncture needling techniques that are distal focused, and of course the Equio system itself. So here's just a real quick rundown of the evolution that we just talked about. So the mapping was developed by Freddie Dahlgren. If you guys want these slides too, I have no problem, Scott and Vicky, sending these over to you guys. If you guys want to have for your notes, I'm happy to send these over for you guys. So mapping was developed by Freddie Dahlgren in Denmark in the 80s for arthritis and neuropathies. Brought to the US in the 90s by Pear, second branch protocol created Bowles, John Bowles Sr., Acupuncture 2000, Acunova, we talked about that. The Acupuncture 48 system, I developed it. So I didn't create it. I'm not taking credit for the mapping, but in terms of understanding each point specific function and creating the protocols beyond the original MA48 protocol, that's the work that I did. And of course, it's a culmination of more than 20 years. As I indicated, I started this research in about 1999, 2000, when I opened my private practice in Westfield, New Jersey. And we're constantly playing with it. Like, it's not done. Like, this is something that we're constantly learning about. Our practitioners who use the system are giving me feedback, and they're using it with patients. So, we're constantly creating more stuff and hearing back from what works and what doesn't work, and we're modifying protocols, whether we're using Micro Acupuncture 48 as a standalone acupuncture modality, or we're incorporating it with other modalities, which, guys, is one of my favorite parts of this system. There's so many systems that are Puritan, like you have to just use this style, or this system, the MA48 blends and can be implemented and combined with any acupuncture system. So when I teach to my students MA48, one of the big things I start with is, like, do not abandon what you already know. Like, this is an additive modality. This is an additive system. It doesn't mean you throw out what you already know, whether it's herbs, whether it's acupuncture, whether it's moxibustion. I know a lot of you guys in Australia are really, really big into Japanese moxa, doing those types of treatments. A lot of the Japanese acupuncture styles. My really good friend, Alan Jansen, I learned a lot of amazing techniques from him. From Aikida Sensei is one of his teachers. So I'm very, very familiar with those protocols. And Alan and Naomi, who do a lot of the micro acupuncture in Australia, they incorporate the micro acupuncture with the TJM very, very nicely. I have other students, myself, I incorporate it with scalp acupuncture, with Tan systems, whatever you guys use, 5-element style, doesn't matter. You can use that, incorporate this system. So I just wanted to take a point to mention that. So what I want to show you guys here is the actual points, okay? So this is the map of the system, okay? This is the map, this is the points. It's online, you guys can get it, and I'll send you guys the slides too. But you have here the map. We have 24 foot points and 24 hand points. That's what we call it, like acupuncture 48. People ask, why the 48? Because there's 48 points. There's a reason I put MA40 up there, because we want people asking. So we don't use all the points, right? That's what Pear originally did. They used all the points. And guys, I just want to mention, I see your questions. I'm not ignoring you guys. I will get to them at the end. So please feel free to post your questions. I will get to them when we finish up, which is not going to be very long. I want to spend a lot of time and really get to your questions. So hang in there. Bear with me for a few more minutes while we go through this overview, and we'll get to your questions. So you guys can see here, the points start with the spleen line. Like, they follow the traditional body acupuncture meridian points. So we start with the spleen A and spleen B point on the spleen meridian, the liver A and liver B point. Oh, let me back up for a minute. So these are the palms, and they're the soles of the feet. They're not the back sides. They're the palms and the soles. I forget to mention that sometimes. So these are on the foot. And if we look at the liver area, guys, what do you see? Post in the comments. What other system do you see that has these same points? Right, the fishbone or the flower bone points from Master Tong uses on the bottom of the foot, right? That's on the liver line, so these points will overlap for those of you guys who are familiar with those points. Then, of course, we go to the stomach A and stomach B points on the second metatarsal. We go to the kidney points on the third. Then we have the gallbladder A and B on the fourth. And then we go over to the urinary bladder points on the outside on the bladder channel, right? Pretty easy. Then we go over to the hand points We see our lung A and lung B points right here. So I'm not going to show you my foot. I'm not that flexible anymore. Creeping up on 50. So yeah, we'll just stick to the hand points. So we got, lung A and lung B point here. Then we got the large intestine A and large intestine B point here. Pericardium A point, pericardium B point. Side note, I'll give you guys a little clinical pearl here. Same price. The clinical application for pericardium B point, it's unbelievable for carpal tunnel syndrome. Like, this is one of my favorite points. 2 to 3 treatments knocks out carpal tunnel. Find the Usher point on the pericardium B point. Such great results with that. And then we go over to the triple warmer, Sanjiao points, A and B. Then we go to the heart points, A and B. And then finally on the outside, small intestine channel, to the SI, A and B points. So those are your points. This is the map. This is the points that we're going to be using in the system. Now, the reason that we recommend live trainings and virtual trainings for this is because there are nuances on finding the points and needling the points. There's needle depths, there's needle angles, there's needle insertion. I did a pretty good job in the book of explaining. So those of you guys have the book, you can resource that. But when we do the needling, guys, you're tapping the periosteum. So you're going in, like, there's no manipulation, but you are going in, you're tapping the bone, and that's it. So real quick, I want to explain to you guys. Hey, Scott, I don't have my clock in front of me. How are we doing on time?
Yeah, 23 minutes in, so we still have plenty of time. Yeah.
Perfect. Okay. Do me a favor. Let me know when we have about 15 minutes left.
15, yeah.
Okay, good. So the distal points versus the proximal points. This was the biggest confusing thing for me when I first got it. I was like, why the A points? Why the B points? If you guys go, without getting too into it, if you guys know the Equio system, go back and look at those points. It'll start to give you an idea of what's going on with that. And those of you guys who want to take or are interested in taking either our online or our live streaming course I'm going to talk to you guys about later on, we're going to deep dive into that. However, I want you guys to get this basic understanding of the proximal points and the distal points, the A points versus the B points, right? It's going to give you something to start to go on. So the distal yang points, right, versus the proximal yin B points. The distal points are generally used, guys, this is guidance. This is not 100% all the time. So this is just to give you a ballpark on how to think about this. Generally speaking, the distal points, all the A points, are going to be used for upper body issues, more acute problems, things that are just kind of on a sudden onset or like maybe a couple weeks, sensory organs, vision, hearing, taste, touch. So we're going to connect those. Energetic issues, right? More we call functional issues. Right? Say energy, functional medicine, energetic medicine. So we say energy, things that haven't really manifested. It's more of a functional problem. Psycho-emotional, spiritual, psychological issues. If it's more mental, emotional stress, anxiety, depression, worry, any of the 7 emotions, we're going to start to look towards the distal points as well. Symptoms, all right? Branch pathologies. We're trying to help people with symptoms. You're going to look more towards the A points, a little bit more reactive, a little more high energy, more external pathogens, right? External wind, external damp, external heat, external cold, external attack of wind. So whether it's a cold or the collaterals, catching a cold or a virus, or it's like a stroke, like penetrating collaterals. So it's external wind invasion, external damp, external heat, WDPO, some type of external invasion. We're going to use the A points. Excess conditions, right? Hyperactivity, heat, excess heat, where there's not a lot of insufficiency. So more like fire type things. Yin deficiency from hyperactivity versus heat from yin deficiency. And of course, hot conditions, more inflammatory process that's going on. Okay, and with hot, you can actually bleed the points too. If you find the organ, you find the A point, bleed it. It's another little free tip for you guys, just because I love Scott.
Thanks. So, I'll buy you coffee.
So so now the B points, right? We're going to go. So the A points are on the top, and the B points are more proximal. Okay, A points are more distal, B points more proximal. So the B points, or the yin points, are more yin in nature. Okay, they're going to be deeper, deal with some of the root pathologies, the lower part of the body, right? The trunk of the body, lower extremities. Like if you cut the body in half, the pelvic girdle. So anything that's reproductive, urogenital, kidneys, lower intestines, anything that's like in the pelvic area, any dysfunction that's with that area, we're going to tend to want to look at the lower, the foot points, okay, or the yin B points. Things that are chronic, diseases that have been going on for a long time, long-standing disease processes that are, that are, people are sick, that they're having a hard time, they're struggling with. The main organ, okay? So so the sensory organ, let's use the liver, for example. So we're gonna use the liver A point to treat eye conditions. We'd use the liver B point to treat hepatitis, to treat fatty liver, to treat cirrhosis, to treat biliary stasis or something like that, or any liver-related condition, all right? Another example is maybe we use the, maybe you're treating for COVID, right? Maybe you're gonna use somebody who has loss of sense of taste and smell, which point we use for that? Maybe the spleen A point, right? Because they can't smell, they can't taste, or the lung A point. So we start looking at those. If we want to do the pancreas to deal with more like blood sugar or pancreatic issues, we're going to use the spleen B point. If there's bronchitis, emphysema, pneumonia, asthma, any chronic respiratory diseases of the lung, we're going to look more at the lung B point. Does that help? Kind of making sense? Hope so.
Yep.
All right, good. So we're also looking at more material, so more substantial disease processes where we're seeing more of a functional problem where we're using the distal A points, where the accumulation of damp, accumulation of matter, of fluids, of protein that builds up. So blood stasis, fluid stasis, phlegm stasis, any material like a tumor or a cyst or a hematoma or a lipoma or something like that. So anything that's creating mass, a fibroid, something like that, a mass that shouldn't be there. We're going to start looking more towards the liver point, the B points. Also, the body, all right? So again, more body issues. So there's more psychological issues, want to look towards the A, but if it's a body pain, a body dysfunction, more, material, physiological processes, we're going to look more at the B points. Also the roots, right? So we have our branch treatments, maybe we're treating like a headache, right? So we want to use some of the head points. Maybe we've identified somebody's got a gallbladder headache, so we're going to do the gallbladder A point, right? They got temple headache or something like that. But we've identified that although it's a Tai-Yang headache, maybe it's coming from a kidney deficiency. So we want to go to the kidney B point, because we've identified that the root is really the kidney, the water is deficient in the pulse, the tongue. We see the kidneys really the deficiency that's causing the headache, which is causing liver rising, and that qi is going to the gallbladder or the Tai-Yang channels and excess there. So for the symptoms, we want to use like a gallbladder A point to address the temple area. But if we've identified through the tongue and the pulse and the inquiry that, yeah, this person's pretty kidney deficient. So the liver is heating up and the gallbladder is heating up because of the deficiency of the yin or the fluids of the kidney, we want to go to the kidney B point, all right? Because that's the root. So this is how we use the whole system to treat both root and branch. Of course, more internal disease processes as opposed to external, internal wind stirring, any of our patterns of disharmony that are like non-external pathogen. Deficient conditions, which we know, especially people as we age, There's not a lot of excess, you know, when we're younger, teens, 20s, 30s, but, you know, once you start creeping up into 40s, you know, we're starting to look at more primarily deficiency conditions. And also your constitution's got a lot to do with that as well. And then finally, we'll wrap up with cold, all right? Anything that's cold standing, that's we're going to get deep, right? Really get to the deeper problems. So we'll look at treating the cold. So that's it. So those are the distinctions between the A and the B points. Now, how do we use the points to treat pain? All right, I'm going to give you guys this. So the first thing we do is we identify the location of the pain. All right, let's use our headaches. Let's say somebody comes in with a temporal headache, a Tai-Yang headache. We identified the organ of the meridians. All right, it's on the gallbladder channel. All right, so Tai-Yang headache, we're going to be looking at what organs. Symptomatically, we're going to be looking at Sanjiao, triple heater, and we're going to look at gallbladder, right? Because we know those are our paired organs. Don't think I have to get too into that for you guys. So we're going to look at those points to start. And we're going to identify the organs. So we have the Sanjiao, we have the gallbladder, and where's the dislocated, the upper part of the body. So what are we going to look at? The A points, right? It's acute, headache just came on, it's hot, upper part of the body. So let's start looking at the Sanjiao A point and the gallbladder A point. Those are the first things I'm going to look at. Maybe I'm going to do my tongue and pulse again, and we'll again go back to, we found that there's kidney deficiency, and we find that they got low back pain as well, and they have frequent urination, and maybe they have orthostatic hypotension. When they stand up, they get woozy, all right? Or maybe they're just tired, you know, they're going through chronic fatigue. So I'm starting to see some signs of adrenal fatigue going on. So we've identified that. So again, we want to go to the root, and we may start doing like the kidney B point to kind of do that. So for the pain, again, we identify the corresponding MA48 meridian, which obviously gallbladder, Sanjiao, and we look for the A points, and we want to palpate, right? So it might not be the exact spot, but we want to kind of palpate around. Again, I'm just going to use a Sanjiao A point because I'm not pulling my feet up here for you guys. Sorry. So we'll do this. We'll start palpating. You know, you can use your point finders. You can use your thumb. I like you guys use Korean hand acupuncture. They have these really good like little tools you can get. In the States, we have Lhasa OMS. I'm sure there are, you know, auricular probes and stuff like that you guys could find. You could either use a point locator or stuff like that to find the points, but you can certainly find the hot spot. This system, when treating pain with the MA48 system, you only needle the hot spots. So if it doesn't hurt, it's not really an active spot. So that's why we say it's guidance. We're going to give you guidance. But if you still feel compelled, if you want to try and you're like, hey, you know, I really think this is going to do it. So even if it's not so sore, we know in Chinese medicine that you can always explain everything away, right? So if it's not sore, we could say it's insufficient, or maybe there's not enough qi, there's a blockage at that point from the micro-macro, so there's an obstruction here that's causing qi stagnation to accumulate here, so maybe that's reflecting in this point. So first thing is, if you find a hot spot, needle it. It's an absolute go. If you don't find tender, you know, and you feel that deep feet, does it hurt? You know, you don't want to, you know, hurt the patient, but you certainly want to, you know, explore the area and palpate. So, and then you just treat it till you get a result. You know, sometimes you may have to, you know, go in a couple times with a couple points, but really find the tender area. And in my experience, it's there. Most of the time, sometimes you have to just maybe, again, so maybe you're going to kind of go here and that doesn't work. You want to change your angle, you know, maybe go up this way or down this way. Just kind of really explore all angles of where the pain could be hiding out, because you can get, you know, these kind of little balls. I think Kiko talks about them too sometimes, where these little like stagnation points that you want to get into, sometimes they can hide around the bony prominences. So just take your time and kind of sniff it out, and kind of, you know, you can run, but you can't hide. Get in there and find that thing. So just treat it till you get results. How do you get a result? How do you feel? With pain, where's the pain? Better, worse, 1 to 10. Start. Headache, it's a 6. All right, does this hurt? Not so much. Well, how about that? A little bit. Oh, how about that? Yeah, I feel that. Okay, great. Pop a needle in. I usually use 1/2 inch. guys, don't use less than 34 gauge. 36 is too thin. Going through the hands and feet, if you're really good, you can try it, but I found 36 gauge or thinner, you're going to bend. They're not going to get through. So I recommend 34 gauge. Starting out, use your 1/2-inch needles like your ear needles, and that'll be great. Go in fast. This is one of those things where people kind of freak out because like, I don't want to hurt a patient. Just do it. It's practice. You'll get in. You'll pop needles in. Same thing with the ear. The ear can be pretty tender too. So, you know, those of you guys who've seen me do needling, you see it's like really quick. Okay, so we got that. So that's the system. Recap real quick. Identify the pain where the location is, location of the pain. In this case, we use the example of the Taiyang headache. Identify the organs and meridians where the pain is the function is located. We went with Sanjiao in gallbladder. Identify the corresponding MA48 meridians and the points we're going to look for. Gallbladder in Sanjiao. We're going to start to look at the A points, but guess what? Are we going to not check the B points? Of course, we're going to check them just because we want to see if they're active as well. And then treat the point until you get a result. The patient basically saying, I feel better. Okay. So how do we stimulate the points? There's a lot of ways to do it. We can use acupressure, right? Use acupressure devices, thumb, hand, or any devices. Acupuncture with the needles, obviously. You can use microcurrent stimulation. You can use laser acupuncture, moxibustion, shonishin, plum blossom, kind of tap it like there. Magnets, pellets, ear seeds, essential oils, whatever you guys want to use. All these methods are referenced inside the MA48 book. And this is just a picture that we have in the book. These are just all the implements. And if you see on the bottom here, that's one of the things I was talking about. But we'll use like the electrostim point finders and stuff like that, Moxa, laser, all kinds of stuff, okay? So MA48 for eye disease. I just want to touch on this real quick. We'll get to you guys Q&A. So people ask, what kind of eye diseases does MA48 help? I am so glad you asked, you amazing people. Macular degeneration. We know that was the first eye condition that MA48 was used for, both wet and dry. Dry is just the presence of bleeding, as some of us know. Stargardt's macular dystrophy, that's a genetic condition that falls under the retinitis pigmentosa umbrella, where it's a genetic condition, early stage, called juvenile macular degeneration. It's not age-related. It's not a cardiovascular disease. This is a genetic condition where the body is actually attacking the cone cells, and you have a degenerative process where the immune system starts breaking down, and you have a sclerosis actually of those cells. Glaucoma and all forms of glaucoma, retinitis pigmentosa, RP, Usher syndrome. Usher syndrome is RP with the added hearing loss. Optic nerve atrophy and all of its varying underlying causes. Diabetic retinopathy, we see a lot of that. Dry eye, that's one of the most common things we see as well. Just blurry vision, nearsighted, farsighted, migraine headaches, like computer eye strain headaches, computer eye syndrome. A lot of people are getting that. We're on our phones, stuff like that. Floaters, cataracts. We're seeing a lot more retinal occlusions. What's that? Eye stroke. We're getting very, lot more doctors are referring patients for eye strokes. Why? They give them a steroid and a shot and send them home, and that's it. They don't really have anything. It's like brain stroke. They don't really have any rehab. There's some drugs, blood thinners, steroids. That's it. They don't really do that much. So as you guys know, the MA48 system is currently the gold standard in ophthalmic acupuncture. Based on my experience, I have used pretty much every eye system that I know of. I've tried pretty much all of the main systems. And without question, I found that the Micro Acupuncture 48 system, whether it's used alone and or in conjunction with other acupuncture systems, which I'm a big advocate. I'm not, again, those of you guys who know who work with me, I'm not a Puritan. Well, you can't use that system with any other system. No, like none of that. This system integrates fantastically with any other system. We've created now over 25 eye protocols. We have like 50 protocols, but the eye protocols are alone We have so many protocols that we've developed for various eye conditions. Last year we created a different training because people are just like, I don't care about all the theory. I just want to know what points that I could use. So we're like, okay, great. So we created a course called Microsystems in Ophthalmic Acupuncture, where it really skipped all the theory. We just kind of unloaded 25 protocols from scalp to auricular to Micro Acupuncture 48 to body points to tongue and ton, all the systems, just the points that help vision. And then of course, those of you guys interested, we do offer, obviously not now, we canceled most of our trainings, but we may be doing another training. This year, I put a poll in our MA48 group because I had about 4 or 5 people asking me if I'd be willing to do a live stream training for the MA48. So I'm kind of gauging interest. My preference, of course, is to always do that training live, but due to COVID, it's not possible right now. So we do have the courses online. I am almost definitely going to be offering, because we had plenty of interest, the training in live streaming. So let me just stop this right now because I want to get to all of your questions and comments and complaints. Awesome people. Wow, got 103 people on the call, not including Facebook. I am impressed, Scott. Very well done.
Bring it on, everyone.
Yeah,
I think
man,
so, a lot of interest.
You guys are awesome. Okay, I'm just looking at the questions now, and then I'll get to the chat. So somebody has a question here. Can we use the AccuPen? Absolutely. All right. And my whole thing with that, guys, is you could use whatever you want as long as you get results, right? Try whatever you want. I'll give you the theory. I'll give you the points. It is up to you to use your creative genius and clinical amazingness to get whatever result you need to get. However you get that, that's at the end of the day, that's what it's about, right? Yes. Your patients are coming in to get results. Results matter. How you get there, you don't want to hurt the patient too much, but however you get there is great. Just get there. So trigeminal neuralgia, fantastic. I actually have a guy right now that I'm treating who has been to, this guy's done everything. He's been to 5 acupuncturists, very good acupuncturists. And I was shocked. I was like, what are you seeing me for? You went for scalp, you've gone for, some really good acupuncture in my area that I know pretty well, and he hadn't had results. And I was like, okay. It's like the only thing I got is really the micro acupuncture that's different, and I'm happy to try that with you. And what I told him I was going to do is combine that with electroacupuncture to see the kind of results that we got. So yes, I have a case that I'm working. He's had it for 5 years, really, really bad TN, and we're seeing tremendous results. Also Bell's palsy. Guys, those of you guys who treat a lot of Bell's palsy, one of my good friends and colleagues in Dallas, Texas, Carlos Chapa, Dr. Chapa uses MA48 and combined with his Bell's palsy cases. That's one of his areas of specialization. So he uses a lot for trigeminal neuralgia, Bell's palsy. So yeah, I hope that answers that questions. Yeah, the book too, Scott will give you guys all the deets on how to get the book. Hit him up. I'm just going to check these off that we answered these. And, so cataracts. Okay, cataracts generally, we talked about last time, is primarily a deficiency of fluids. So what happens is the lens of the eye oxidizes and dries out, right? Pretty much anybody who, if you live long enough, you're going to get cataracts right now because they don't have any treatment that reverses the protein cross-linking. So for cataracts, what I will use is acupuncture points just around the eyes, periorbital points, but the MA48 points I will look at is lung and kidney points, okay? So start to looking at those again because we're looking at our fluids. Again, the supplement, that I will use in addition to that is a product called Can-C. And I'll post this, I'm gonna type this in now, Can-C. And that's an eye drop. All right, that's an eye drop that has NAC in it, which is a precursor to glutathione, which, as we know, it's a really big antioxidant for the body. And I have actually seen early stage cataracts reverse. Shocking. I was shocked. It actually reversed some early stage cataracts. Mid-stage cataracts and early stage, it will dramatically slow down. But end-stage cataracts, guys, they're kind of going to need surgery. You can't really undo that. So it's like, at least not right now. So that's what we do for cataracts. And again, go through, do your TCM diagnosis, treat your pattern. Like use your TCM points, use your body points, and then you can add the MA48 points to it. You can add the, your CAN-C, your eye drops, or, anything else you're going to use. Okay. So that's for Miss Rebecca. And then we have Yoon is, how successful is MA48 for corneal problems like keratoconus? Great question. Keratoconus, here's my experience. I have not gotten the best results with keratoconus just using MA48, but here's what I have done. I've had patients use sandbags. You ever play, any of you guys play cornhole where you take the bean bags and you try to throw it in the holes? It's a big game that's played in the States, usually when people are drinking beer, hanging out. It's a good outdoor bar game. Anyway, so they have these bean bags filled with, it's like kind of bean bag. So what you do is you put a little pressure on the eye and it actually acts as what's called corneal refractive. It puts a little weight on the lens and it helps push it back a little bit. So if patients do that at home, that could help with the acupuncture. But look for the lens stiffening, all right? Could be a yin deficiency or dryness in the lens. Usually it's an operable procedure. What we have been able to do is take patients who are inoperable and soften it up to the point where it becomes operable. And the reason we do that is because keratoconus surgery is very successful, extremely successful. So, and same thing with corneal transplant. There's no blood flow to the cornea. So the lens transplants are very, very successful. So whether it's a corneal dystrophy situation or there's damage and they have to do a corneal transplant, these are supportive treatments that can help. Again, for keratoconus, we can take inoperable, make it operable. For corneal transplant, we can help with pre and post-op and just make sure the procedure goes very well. We see a lot of those cases. So I hope that answers. It's Christiane. And let's see, our next question here. Any difference in left and right side? No, great question. So this is not like an ipsilateral, unilateral thing, needle to tender point, right? Eye treatments, we're gonna go with our protocols and we're gonna teach you guys how to use the system that way. But with the pain treatments, you just palpate and find, you may find ipsilateral or contralateral, but I haven't seen a consistency there. So, you can check that, check for yourself to see, but I would look at both sides to see and just needle what's tender, and less needles is more, right? When we do acupuncture, the less we can do to get a clinical result is the best. So let's, find the tender points, needle them, see if you get a result. If pain improves, then we'll be good with that. And left and right side, we talked about that. Teeth grinding, long jaw, absolutely. Local points, distal points, and of course you got to deal with the stress because you got to find out, is this a stress thing or they just have lockjaw? So I use electroacupuncture in distal. First I'll use distal to release the jaw. I'll have them do exercise while I'm doing my distal points. And then after it's there, I'll find some osher points and usually I'll do some electroacupuncture with it. And then I'll use some ear points if there's stress and anxiety involved. And I'll usually put them on the Canavision as well, and then a Chinese herbal formula to deal with whatever underlying pattern is. But again, we're gonna go looking at this Sanjiao, and we're gonna be looking at the stomach channel for a lot of these types of things. But yeah, can be stress, can be just a SCM thing going on, or the masseter issue, something like that. So look root, look branch, and then look at your pattern too, what's going on. But absolutely, we've had some pretty good results with lockjaw and bruxism, which is teeth grinding. Got about 10 more minutes, so I'll keep them coming, guys.
Keep it coming.
So we got neurological diseases like Parkinson's, yes. So that's where I was going. I didn't get too into that this time because that's a whole other topic of conversation. But I see a lot of patients, stroke, dementia, Parkinson's, Alzheimer's, any of the brain conditions, because the MA48 targets the central nervous system, all right? We get really, really good results, but all these points that are treating the eyes, guess what, guys? They're also treating the brain because the brain sees, not the eyes. All right. So absolutely, these points are going to be really, really good for any of these conditions. Is it standalone with Parkinson's? No. All right. We got to do our herbs. We use hyperbaric. I recommend things like IV glutathione, which is really good. We use supplements to increase the dopamine production. I use a company called Apex Energetics. I'm sure you guys have your equivalents, but any supplements that are really going to help the body produce its endogenous production of dopamine is going to be useful. We also want to look at things like heavy metals, toxicity, inflammatory processes. But guys, between using MA48, some of the IV therapies and hyperbaric, we get incredible, and scalp acupuncture for sure. So I use scalp acupuncture, I'll use like the basal ganglia points like UB10 or the scalp points in the back, and then I'll kind of stim that up to the tremor line, and then use my distal MA48 points. So since you're asking and since we had some time, that's what I do for MS too. Yeah, same thing with multiple sclerosis. And all my patients with these are on the Canavision, which is our CBD product, which is we're using primarily for neurological conditions. Okay, let's moving on. Shingles, absolutely. We've had tremendous results with shingles and neurological. The pain we're using for that, and again, I'm using CBD just because it helps the inflammation. Chinese herbs, we're using heat clearing herbs formulas that'll address with that. But we also want to boost the immune system because shingles is a heat toxin, but it's usually a result of stress in the immune system's tanking. So we have to look to boost the immune system. Eye stroke, how often, how soon? The sooner the better, every day. It's like brain stroke. The sooner they can get in, as soon as the doctor's like, they're going to give them a shot, they're going to put them on some steroids and maybe put them on some blood thinners, that's all they got. As soon as you get them in, hit it fast. Why? Because the oxygen deprivation from the occlusion, just like brain stroke, the longer it goes without oxygen, the faster we can get in to target the cells, to wake them up, to get the blood flow going, to deal with the hypoxia, to deal with the inflammation, to deal with the blood stagnation, the fluid stagnation, the phlegm stagnation, get them on a good Chinese herb formula to deal with the post-stroke, the stroke sequela. So the soon as you can get on this, the better. That's one of my biggest pet peeves in the States, why stroke acupuncture is not primary treatment for stroke patients. Those of you guys who've been to China or other hospitals where they're implementing scalp acupuncture and acupuncture with stroke, it boggles my mind. I'll get off my soapbox now and continue.
And the Sinao Kai Chow, right? From Clayton.
Yeah. Needling is palms, palms and soles of the feet. So yeah, needling is only in the palms and soles. That's the mapping. Diabetic, hypertensive, peripheral neuropathy. Definitely considering using the Micro Acupuncture 48 system with them. My father is the reason I actually got into acupuncture. My father was on high blood pressure medication for 10 years. I was a senior in college on my way to med school studying for my MCATs. And my father, after 3 months of acupuncture, was off all his medication. And he continued 3 months, another 3 months. After 6 months, he was like, dropped weight. His blood pressure was normal. And that's how I got into the medicine. Actually, my father managed his hypertension. And he's like, oh, you got to check this out, this acupuncture. Like, acupuncture? I'm going to med school. Yeah. So I started learning about it. It was love at first sight when I started learning about it. So yes, my father is my first testimonial for the efficacy of acupuncture for these types of things. Peripheral neuropathies, absolutely. I have a bunch of cancer patients that I'm treating who've gone through radiation and had problems with neuropathies from radiation. Also diabetics. Absolutely, extremely, extremely useful for these conditions. In my clinic, I often combine it with electro, vitamin supplements, Chinese herbs, and we use hyperbaric oxygen for a lot of these conditions as well. Let's move on to the next. You find clients find it painful needling. Yeah, the majority of my patients don't mind. It's like acupuncture. When you first started learning needling, if you guys remember, sorry, I got an itch on my nose. I'm scratching it. You got speed. So the micro acupuncture, like everything else, it's speed of getting needle in. You want to bypass the thick skin layer, get it through. There's nothing that you want. If you're a timid needler, get over that before you start using this system. Most of what we do with this is freehand. You can do it with a guide too, but it's not so easy and it takes a lot more time. So we go over in our training how to do freehand needling with this. Yes, same needling method with A and B points. I'm just knocking these off as I go through. Client who has spinal injury and gets pain in his leg from 5 p.m. to 5 p.m. to 1 a.m. every day. Okay, so you look on your Chinese clock with that. That's yin deficiency, right? Because he's getting it later in the evening. Could be cold induced, but if it's 5 p.m., we suspect yin deficiency, kidney, liver yin deficiency, spinal injury. You know, we know it's going to cause jing. So it comes from thighs up to his lower abdomen, injury at T10. Yeah, I mean, look at the meridians. You know, you're going to look about T10. We're looking at what? Liver, gallbladder, pancreas, that kind of area. So start looking at your middle jiao points and start poking around those points, A and B points, and see what's tender. I would just look and see whatever points are reactive and do that and add that to whatever you're already doing. Maybe you're doing E-stim and moxa around those points as well. And anybody with a spinal injury like that too, if it's not so, even if it's been around for a while, do your acupuncture, your scalp, but you know, definitely maybe consider have them doing some hyperbaric. And I know that's not the topic of conversation, but since you're asking, I'm going to give you my opinion. All right. A couple more questions before we wrap up. Glaucoma, have you seen optic nerve recover? Yes. I absolutely have seen regeneration of the optic nerve, recovery of the sclerosis. We've seen activation of dormant optic nerve cells, as well as dormant retinal cells, photoreceptors, rods and cones, as well as the visual cortex. So the visual cortex, the brain, the optic nerve, and the eye is all part of the system. Any of those cells can go dormant, and we can see a recovery, spring back into function after needling those points. Sometimes immediate results sometimes. Let's see, how long needles it? Great question, 30 minutes. Needles saying 30 minutes. With kids, can be in and out. Treatment can be done in that point after they kind of get the Da Chi thing. I'll leave them as long as 2 hours sometimes for people who are like really, you know, freaking out or post-stroke or have a lot of acute pain. I've left them in for up to 2 hours sometimes. That's that. And is this recorded anywhere? No, sorry, you're out of luck. I'm kidding. Yeah, it's recorded, and you guys will, Scott will help you guys out with that. So hit Jason, hit Scott up, and he'll give you the info on that. Time retention, 30 minutes. Talked about that. Hand sanitation. Yep, just you know, swab down the hands. Swab your hands, use alcohol. I like hydrogen peroxide more than alcohol just because it kills more germs. That's my preference. But yeah, you know, clean the body, the hand and feet, like, or you just have them use, you know, hand sanitizer works just as good, especially more so with COVID. How effective on skin conditions? I haven't done a lot of skin conditions. Truth be told, using MA48, I just haven't. I use a lot more herbs with that, and I use hyperbaric. So Yun, to answer your question with full honesty and transparency, I do a lot of food allergy testing. So if I can't answer that just saying I have used MA48 exclusively for skin conditions. Of course, I would start looking at the gut microbiome. I'd look lung, large intestine. I would look spleen, look for the hot organs. Again, go back to, yeah, hyperbaric without question. Hyperbaric, I'm sorry, real quick. We got about a minute or two. So hyperbaric is a pressurized oxygen therapy treatment. So hyper means increase, baric is pressure. So we're increasing pressure while putting somebody on oxygen. And that temporarily creates a surplus of oxygen for the body to help cells recover that can't breathe or can't get certain blood flow. I don't want to take too much time on that. If you guys are interested in that, if you go to my YouTube page, on Dr. Andy Rosenfarb. Just 2 weeks ago, I did a whole lecture series on what hyperbaric is. That was part 1, and part 2 is hyperbaric for eye disease. So you guys can check that out. Feel free to email me. Yeah, okay, guys. So I'm going to wrap up questions there. And yeah, we got, I think we're good. Yeah.
Yes. Yeah. Unfortunately, time's up. I think we still have a lot of questions to answer on the other side as well. But I think we may be able to do another one, maybe
Yeah,
next
and
year.
guys, if you go into the Micro Acupuncture 48 Facebook group, feel free to post any questions there. And please, 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 if you're going to ask a question, you want me to answer it, please tag me because I run like 10 Facebook groups and I'm like all over the place sometimes. So if you tag me, then I'll get alert. If you don't tag me, I may not see that you're answering the question. So just wanted to add that.
Great. So some of you might join the Zoom a bit late. So if you want to watch a replay, you can join Sustain Health Academy group, and we have the recording and replay in there as well. So yeah, so the question, and some of you came late. So yeah, you join us to watch a replay. And for those who want to get the slides, you can, let me see.
I'll send them out to you tomorrow.
Yeah, yeah. Vicky can help me to put on the thing.
Yeah, Vicky, if you could shoot me an email either tonight or tomorrow, I'll send you the PowerPoint and you can send them out to your group.
Yeah. All right. So let's wrap up. Thank you, Andy. Again, that always, Andy's one of the best speakers that we ever have. So he's the most popular one. We're very, very lucky to have him to give us so much info on MMA 48. So yeah, definitely we want to, yeah. So if you want to get the slide, you can join Andy's Micro Acupuncture for a group and academic group, and or send us email if you can bring one of the acupuncturists, and yeah, we send you the slide. All right, thanks.
Thanks, Scott. It's awesome. So good to see you again. You too, Vicky.
Okay, see you guys and talk to you later. Have a good day. Bye.
Take care, everybody.